Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Friends, we were discussing about the problems of working mother with respect to breastfeeding. And in the last three classes, we have seen so many aspects. And in continuation of the same, so today we will have discussion on some other aspects related to the same problem. Now we were talking continuously about expressed breast milk, and it can be well stored in the refrigerator. In the freezer it can be stored up to 3 to 6 months also. So only thing is, some of the things you should not forget when you're giving the EBM. Number one is, if you are taking the frozen milk from the refrigerator and for the usage, then before using it has to be pre-warmed. It has to be warmed. That means it has to be kept in the room temperature for 2 hours, and later onwards, just by taking hot water, the vessel which contains the EBM should be floated on the hot water so that it will get warm. Then only it has to be used. Number one. Number two, the breast milk which is previously freezed and now used, if some amount is left over, it should not be refreezed. Rather, it should be discarded. Therefore, always when you're putting the things on the freezer, milk on the freezer, use the small breast milk bags so that wastage will be inhibited. Now again, the milk which is stored in the fridge will have slightly different color from the fresh milk, so mother should not consider this as a spoiled milk. Okay, she should not have a misunderstanding that the milk has been spoiled, therefore I have to discard. No, a stored milk will always have a slightly different color from that of the fresh milk. That is because of the fat layer collection in the above portion. Okay, so another is, if the mother is giving complementary feeding to the baby, after 6 months we have to go for complementary feeding. Suppose if the mother is giving complementary feeding to the baby also, in between you have to continue to give the EBM to the baby. Now another important thing is, the quality of the breast milk may be affected. That means the EBM you are storing, the quality of that EBM may be get affected. Temperature at the time of the expression, so when your hand expression or the breast milk pump expression you are doing, so temperature which you are maintained, then the temperature which is maintained in the storage compartments like electricity cutoff and all those things, and timings, and also nutrition of the mother definitely have its own effect on the quality of the breast milk. If the nutrition of the mother is very poor, of course the EBM will also have a poor nutritional value. Another thing is, while you are doing the expression, breast milk expression, then you have to wash your hands very carefully, because the hygiene matters very much. So you have to wash your wash your hands, and also you have to wash the breast area also. Okay, so do not use any of the plastic containers, flat plastic bottles or feeding nipples, etc. for the purpose of feeding EBM. So one thing is very clear, when the mother is going to work, she is a working lady and desperately she wants to continue the breastfeeding, she need cooperation from all of us. Okay, so she need cooperation from the community, she need cooperation from the government. Of course, government is given utmost cooperation. Okay, so community, government, family members, and even the close relatives, husbands, etc. So she need cooperation from all of us. So then only she is able to continue the breastfeeding even at the working place. Now we need to provide the good nutrition to the mother, and we also need to give the good emotional support to the mother, because breast milk secretion is not a mechanical process. Breast milk secretion of the mother is a hormonal, mechanical, neuronal, and as well as emotional process. Okay, so a lot of things depends how relaxed mother is, how cool mother is, and a anxiety mother or depressed mother or excited mother, definitely she will have less breast milk secretion. Okay, now we know that the cooperation which is extended from the family members is very important, because when mother come back to home from the working place, definitely she is exhausted. So that time somebody should be there to take care of her. Okay, so give some, so allow her to give some time to the baby who is waiting for her mother since morning. Okay, so somebody has to take over the work of the home during that particular hour. So working mother's guilt, now this is the biggest problem. Working mother's guilt will be there. So a mother who is working, always inside the mind, so one question or one thing is torturing the lady. So what is that is, so is I'm doing any mistake, whether I'm feeding my baby properly or not, whether because of my this work baby is going to badly affected in future. So all these questions will be bombarding in her mind. So that guilt should not be there, and it's the responsibility of all the family members that mother should not feel this particular guilt, because once the guilt is there, it leads to depression or something like that, anxiety, etc., and that itself going to affect the breast milk secretion. So cooperation from all of us is very important for the working mother. Now just a brief introduction that a CDC recommendation for the storage of the breast milk, how you can store the breast milk, especially EBM. Now freshly expressed or pumped breast milk in the room temperature of 25 degree, it can be stored up to 4 hours. Okay, these are the lower limits. 4 to 6 hours it can, maximum 4 to 5 hours it can be stored, and in the refrigerator in the upper compartment it can be stored up to 4 days or even up to 4 to 6 days, or in the freezer it can be stored up to 6 months, 3 to 6 months. And thawed or previously frozen breast milk, now just pre-warmed, and this can be usually within 1 to 2 hours. Once you take the breast milk out of the freezer, then it should be, for the next 2 hours, it should be brought back to the room temperature, and later onwards, within few minutes or hours, it has to be used. Okay, so the previously frozen breast milk in the room temperature, it has to be used within 1 to 2 hours, and that means in the refrigerator it can be kept for 24 hours, and in the freezer never refreeze. Okay, एक बार आपने freezer से निकाला, उसके बाद वापस freezer में नहीं डालना है. You have to remove it, because after freezing you have pre-warmed it. Now it brought back to the you brought it back to the normal temperature, room temperature. Now again you are refreezing it, then so many nutritional value of the breast milk will be get lost. So leftover from the feeding, whatever it is left from the feeding, you use it within 2 hours after feeding. Kuch bhi ho, it may be the fresh milk, or it may be stored in the upper compartment of the fridge, or maybe freezer. Once you remove it, and some portion if it is left, it has to be used within 2 hours. Later onwards you cannot use it. This is a strict recommendation. Okay. Now how to start early and set up a schedule? Now this is very important. Now suppose the maternity leave will come to end by next month, 6 months is over. From the next month onwards, mother has to resume her work back. Then the preparation has to be done 1 month prior. It is not that you start for this new schedule after 6 months only. Then it will create a lot of problems in adjustment. So you know that anyway by the next month onwards I have to resume back to my work. So now you start the preparation 1 month prior. The first step is to combine the breastfeeding and working is as early as 4 weeks after the birth. So that means, so you know that anyway I have to go to the work, that time I have to get adjust myself. Now fix the schedule earlier. Okay, so because this is a time when we are setting up the feeding schedule and establishing the milk supply. Suppose in the 5th month is running, 6 months onwards you have to resume back to the duty. The 5th month itself you start giving the EBM 1 or 2 times per day. Okay, 5th month itself you learn how to remove the breast milk, express breast milk by using breast pump or manual method, and how to store it and how to remove it, and all these things. If you do it 1 month prior, then you have a set schedule and you don't have much problem afterwards. So if the woman gives 4 weeks of quiet nursing time without involving in any social media and mobile phones, computer or any other distracting activities, then she is not only setting up a definite feeding pattern but also the strong maternal bonding also. Now during this 6th month, okay, so you have to practice yourself. Okay, you should be away from, suppose in the 6th month you completely give your time to the baby. Completely you give to the time to the baby. Don't involve yourself in the social medias, mobile phone, TV serials and all those things. Okay, then you focus on fixing a schedule. Okay, morning you are giving feeding, and by 10 o'clock also you are giving feeding. Okay, in between the afternoon and the late afternoon for the evening feeds, you replace it by the EBM if it is possible. Okay, if it is possible. Again, night hour you go back to the routine direct breastfeeding. So now baby is also habituated, and you are also get adjusted for this new schedule. Now, how working mother should overcome this challenge? Okay, now train yourself and also train your baby. Okay, start this process 1 month earlier so that you can earlier to resume your work. This helps to learn how to express, same thing, it is repeated, and fix the time schedule, and how to store, and also how to maintain the vessel cleanliness, and also identifies baby's hunger cues and timings. This is very important. So if you're closely observing the baby, you can now you can identify which particular time I have to give the EBM. Okay, so okay, after 1 month I will be in the working place at 12 o'clock. Okay, baby is having hunger cues at 12 o'clock, so I have to give EBM at 12 o'clock. I have to inform somebody in the family to give EBM at 12 o'clock. So similarly at 3 p.m. So identify the timings actually when the baby is feeling hungry. Okay, so this practice has to be started 1 month earlier. Get the help of all the family members and the community whenever it is required. Okay, this much is about the background aspects related to the problems of breastfeeding mother. Now, how to overcome this problem? EBM is one of the way out. Okay, EBM is the breast milk that you are giving, but apart from that, a working mother will have so many other problems, okay, that she has to face, and all such problems we will discuss in the next class. Thank you very much for listening to me. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.